the Older Americans Act, the local impact of the law, and the upcoming reauthorization. Today's hearing provides this committee an important opportunity to discuss the unique impact the Older Americans Act, or as we call it around here, just like everything has an acronym, OAA, that this act has on communities all across the country. OAA was passed into law in 1965 to establish a network of social services to support older Americans, complementing Medicare and Medicaid. By all measures, the Older Americans Act has succeeded. Since its passage, OAA has served as the foundation for community social services for older adults, providing nutrition services, legal support, and social networking, among other services. The act has a tangible impact on local communities. Funding flows from the federal government to states and to communities to allow programs to be delivered in a way that works best for the locality. This law supports countless older adults in nearly 20,000 service providers around the country, 20,000. In Pennsylvania, an estimated 27% of older adults served by OAA are under the federal poverty line. The law's nutrition programs alone serve approximately 85,000 older Pennsylvanians. Today I'm releasing a brochure, which I'm holding up and you wouldn't be able to see from the distance of your seats, but it's a brochure that highlights the impact of the Older Americans Act on Pennsylvanians. This brochure is entitled Federal Policy on a Local Level, the Impact of the Older Americans Act Across Pennsylvania. And it just has some examples of individuals from different parts of our state and the
themselves rather than the cumbersome way of maybe involving this place. I hope that we can address this issue by doing more to connect existing resources to these communities. Look forward to working with my colleagues and stakeholders to advance these priorities in the Older Americans Act. I yield back.
Thank you, Ranking Member Braun, and I want to thank the Ranking Member for his work on the reauthorization that we're working together on. I'll introduce our witnesses now. I'll introduce each of our witnesses before their testimony. I'll start with our first witness, Janet Billett. Janet, thank you for being here. She's from West Decatur in Clearfield County in the middle of our state, kind of north central part of our state. And she receives mail deliveries and other services from her area agency on aging. She'll share how meaningful the meals and services she receives have been for her. And I want to thank you, Janet, for being here today and for making the trip from Clearfield County. It's not an easy ride. I'll turn to Ranking Member Braun to introduce our second witness.
It's my pleasure to introduce Laura Holscher. She's the Executive Director and Assistant VP of Generations, which is in Indiana's Area 13 agency on aging, located in Vincennes, Indiana, very near where I live. In fact, we're rivals, I think, in a lot of sporting events and so forth, so it's that close. She served with Generations for almost 30 years, including the past 14 years as Executive Director. Under her supervision, her team has received the highest level of accreditation through the National Committee on Quality Assurance. Kudos to you for that. She has served as a board president of the Indiana Association of Area Agencies on Aging and now serves as the chairman of the Public Policy Committee. Thank you for making the trip to D.C. to be here today.
Thank you, Ranking Member Braun. Our third witness is Leslie Grenfell. Leslie is the Executive Director of the Southwestern Pennsylvania Area Agency on Aging, or AAA as we call them. She'll share her experience as the AAA's Executive Director, the challenges they face, and the innovative ways that AAA's handled, service delivery during the COVID-19 pandemic. Ms. Grenfell, thank you for being here, and thanks for your service to older Pennsylvanians and sharing your experiences with us today. And our fourth and final witness, I'll turn to my colleague from Connecticut, Senator Blumenthal, to introduce.
For having this hearing on this very important topic. I'm very honored to introduce Mairead Painter of Connecticut. She is Connecticut's long-term care ombudsman, and she's done really magnificent work in that job. Very proud to be here with you. Ms. Painter was appointed to this position, Connecticut Long-Term Care Ombudsman, in 2018. She has had this position during some of the worst times in our long-term care facilities during COVID. She promotes and protects the quality of life for older adults and individuals with disabilities across the state. She serves more than 30,000 Connecticut residents in skilled, long-term care nursing facilities, residential care homes, and assisted living and managed care residential communities. She also oversees the program's advocacy work and is committed to furthering person-centered care and informed choice for all individuals. Recently, she received the Administration for Community Living's first Community Living Director Care Award, highlighting the work that she and her team have done in advocating and protecting the rights and well-being of individuals in long-term care facilities. I want to thank Ms. Painter for all you have done to protect those 30,000 people in facilities across the state of Connecticut, and especially you're making the trip down here to D.C. and sharing your thoughts on this very important topic with us. I know you have a lot of experience, a lot of insight, and we really welcome and express our thanks to you. Thank you.
Thank you, Senator Blumenthal. We'll turn to our first witness, Ms. Billett.
Chairman Casey, Ranking Member Byrne, and members of the committee, thank you for having me here today at your Older Americans Act hearing. My name is Janet Billett. I live at the Village of Hope. I am 78 years old, and I live in West Decatur, Pennsylvania, which is a rural town in Clearfield County. Before retiring, I worked as a nursing aide. I am here to share my experience as a recipient of the Meals on Wheels and other services from the Clearfield County Area Agency on Aging. I have been receiving Meals on Wheels for 4 years. My husband Richard and I started receiving meals in August of 2020 when he had 5 stents placed in his heart and 2 years later open heart surgery during the pandemic. I was very happy to receive these meals. Every time I received a meal, it always feels like I'm getting a present each meal. I would like to invite you to have lunch with me today. We're going to have, the meal is kibasi, mashed potatoes, sauerkraut, and a fruit cup, brown bread, and if it's a special day, we get strawberry shortcake. Sorry, we will have strawberry shortcake. I was diagnosed with stage 3 colon cancer, and I was also caring for my husband, Richard, who has been sick with many issues for a long time. I also just had an operation for my cancer and had chemotherapy 3 times every other week. Many days I did not feel well, and it was very helpful to have these meals delivered to us. I love talking to Fred. Fred is my meal delivery person. Every day he comes, he asks me how I am. Lots of times I don't see anyone except Fred to see or talk to each day. So I am thankful when he checks in on me. If he doesn't hear from someone, he calls the area agency on aging and asks to make sure that we are okay. A lot of older people don't have family. I don't have family. I have a son, Clint, who is autistic, a daughter, Sarah, who passed away, and my husband recently passed away. Now the Area Agency on Aging has become my family. Today, my cancer is in remission. I am still receiving deliveries for Meals on Wheels and other services from the Area Agency on Aging. I am very glad that they give us vouchers through the Senior Farm Market Nutrition Program run by the Agro Department so that we can go to the farmer's market and I can get fresh produce. I can get tomatoes, lettuce, and all kind of fresh foods from the market, and it is good nutrition and helpful in preventing cancer. During bad weather, we also receive blizzard boxes where they send us a self-stable food, and we have something in case of bad weather to prepare. I am thankful for these services, and I'm not sure what I would do without them. Beyond meal deliveries, I also participated in Senior Center. They took us on a field trip to a mushroom farm where we learned about different types of mushrooms and how to prepare them, how bees pollinate herbs, and we went to a flower garden. I love flower gardens and gardens. The Area Agency on Aging also helped coordinate transportation for me when I had to go to the clinic to get chemotherapy. I had to get chemotherapy and blood work every week. And this was not good. Because I live in a rural area, it was very hard to find transportation to the clinic. But Adam was very kind to help me drive me to my doctor's appointments and to chemotherapy. I was very grateful to receive these services and grateful for the friendship I have with my Area on Aging, Kathy Gillespie, who is with the Area Agency on Aging. She is like family to me. I know many older Americans receive Meals on Wheels, and I am thankful, and also I understand that there are many older Americans on the waiting list for these services. I ask you to please help more people get into the program and be able to receive these great meals. Thank you again for the opportunity to share my story.
Ms. Billett, thanks so much for your testimony and for sharing your own personal experience. We're grateful. Ms. Holscher, you may begin.
Senator Braun, Chairman Casey, and members of the Senate Special Committee on Aging. I am Laura Holscher. For 30 years, it has been my honor to serve older adults at Generations Area Agency on Aging. Generations is a program of Vincennes University and is designated by the Indiana Division of Aging's Commission on Aging as the Area 13 Agency on Aging and as the Aging and Disability Resource Center. I want to thank Senator Braun for inviting me today. Under the Older Americans Act, Generations' role is to develop, fund, and implement a broad range of programs and services to meet the needs of older adults and caregivers. We serve 6 counties in southwestern Indiana: Davies, DuBois, Greene, Knox, Martin, and Pike counties. We impacted the lives of more than 35,000 individuals last year. Our entire planning and service area is considered rural. We have 4 hospitals, but in some of our cities, there's not even one primary care physician. 22.7% of the population in our service area is living below 150% of the federal poverty level. Some of the challenges we face as a rural community include lack of broadband internet and limited access to transportation, both of which limit access to health care and social opportunities. Under Title IIIB of the Act, our AAA offers in-home services for frail older adults, senior transportation, information and referral assistance, options counseling, home modification and repair, legal services, the long-term care Ombudsman program, and other person-centered approaches. The flexibility of this funding stream gives AAA's means to meet the needs of older adults in the community, eliminating the need for expensive nursing home care. Our Older Americans Act clients inform our work. Since many have cognitive impairments, we pulled together a dedicated action team to help form partnerships like the one with Me Patio, a local restaurant to provide dementia-friendly dining hours. This was achieved by using some of our Title IIIB funding and supplementing it through our University of Southern Indiana Geriatric Workforce Enhancement Program Workforce Development Grant. I'm proud to say this county was recently designated as a dementia-friendly community by Dementia Friendly America. Another essential part of Older Americans Act is Title IIIC nutrition services. In the past, Generations had provided daily hot home delivered meals to homebound older adults. As the economy shifted, gas prices rose, and the cost of food increased, it became apparent that our operations would need to shift from daily hot home-delivered meals to frozen meals. As we made the shift to frozen meal providers, we searched locally for partners who would be willing to contract with us to provide hot meals. We now have partnerships with a nursing home and 2 senior centers to provide hot meals in their surrounding area. Today, we operate a hybrid program. A client can choose from up to 6 different frozen home-delivered meal service providers or from a hot meal if they live in a covered area. Last year, we provided over 106,000 meals to nearly 1,000 older adults. Our hope was to expand these local partnerships for hot meal delivery, but the funding isn't sufficient. Need is growing in our community. Over the past 2 years, we have seen a 20% increase in calls for meals and have more people accessing our services because they just can't afford groceries or other necessities. Due to the continued rising cost of food, freight, delivery, and labor costs, the same amount of money simply cannot stretch to meet higher cost. In addition, donations, grant support, and community support are down as donors themselves are tightening up their purse strings and prioritizing their own budgets. This has forced us to triage calls and provide meals only to the most at-risk individuals and put others on a waiting list. In the meantime, our trained counselors work with clients to provide alternatives such as enrollment assistance for supplemental nutrition assistance program, referrals to food banks, food pantries, and local churches. Under Older Americans Act Title IIID, we run several evidence-based health and wellness programs, such as A Matter of Balance, Mingo Size, and the Chronic Disease Self-Management Program. Through additional partnerships, we have more than doubled in what we were able to offer. There are also ways to make these dollars go further. Generations and other rural AAAs around the country would benefit from flexibility to use Title IIID monies to fund evidence-informed programs, which are lower in cost and more adaptable. Generations was created as a result of the Older Americans Act. These are just a few examples of how we innovate and adapt to meet the needs of older adults in our rural area. Please keep the Act's inherent flexibility and locally driven structure in mind as you update the law this year. I have 4 recommendations for the reauthorization. First, increase Older Americans Act funding, which has not kept pace with the growing number of older adults or inflation. Second, continue some of the nutrition flexibilities that were extended to AAAs during COVID, or allow for the flexibility to fund innovative ideas in the nutrition program. Third, Allow Title IIID health and wellness programs to be evidence-informed. And finally, we support U.S. Aging's recommendations for reauthorization. Thank you for the opportunity to testify today.
Ms. Holscher, thanks for your testimony and for being here today. Ms. Grenfell, thank you.
Chairman Casey, Ranking Member Braun, and members of the Senate Special Committee on Aging, thank you for the opportunity to testify before you today to discuss the Older Americans Act. My name is Leslie Grenfell. I'm the Executive Director of Southwestern Pennsylvania Area Agency on Aging, serving older adults residing in Fayette, Greene, and Washington counties. It has been an honor for me to serve as its Executive Director for the past 23 years. In terms of population, our agency is the largest rural area agency on aging in the Commonwealth. Its service and planning area encompasses 2,223 square miles. The agency acts as a community vocal point, providing information and assistance, protecting vulnerable older adults, assisting caregivers and their families, reducing food insecurity, and empowering older adults to live independently and to age well. The nutrition program is the cornerstone of the Older Americans Act and includes congregate, home-delivered, and grab-and-go meals, which were introduced during the COVID-19 pandemic. The flexibility of the grab-and-go meal option, where older adults can pick up a meal to take home, has been well received by our consumers. Our home-delivered meal providers, however, are struggling. High cost, long distances between homes, traveling on winding backcountry roads can make delivery difficult. One of our most demanding routes is in the Laurel Highlands of Fayette County, which requires travel through state game lands and is 32 miles long. Although challenging, providers have successfully developed and sustained a service delivery system using volunteers who not only deliver hot, well-balanced nutrition meals 5 days a week, but also provide wellness checks to each older adult, ensuring their safety and well-being. Last fiscal year, approximately 700 dedicated volunteers delivered over 400,000 in-home meals to at-risk consumers. Challenges identified by our 34 home and community-based agencies who provide personal care services in rural communities are the costs associated with transportation due to the distance between consumer homes, the recruitment and retention of direct care workers, and the need for increased reimbursement. Last fiscal year, our agency received $591,073 in American Rescue Act funds, which provided a necessary infusion of financial support, permitting us to help a growing number of older adults. Despite the growing number of older adults and the corresponding need for services projected to increase, no appreciable amount of additional Older Americans Act funding has occurred for over a decade. Increasing Older Americans Act funding and increasing its flexibility is a cost-effective financial investment, which would enable older adults to stay healthy longer, living in their own homes and communities where they want to be, whereby reducing the need for more costly long-term care interventions such as skilled nursing care. In 2023, the Pennsylvania Department of Aging began development of a 10-year multi-sector plan for aging called Aging Our Way, PA. It is a state-led and stakeholder-driven strategic plan designed to help transform the infrastructure and coordination of services for older Pennsylvanians and persons with disabilities. The network of AAAs was essential to the stakeholder process, which yielded over 20,000 responses from across the state. Each AAA engaged their local communities, encouraged community participation, and facilitated listening session, at least one in each of the 67 counties, in over 200 sessions in total. The AAAs are integral to many of the recommendations developed through this process, and we are looking forward to working with the Pennsylvania Department of Aging and implementation. In conclusion, I would like to especially thank Senator Casey for inviting me to provide testimony today. On August 5th, I will be retiring after 48 years in the Aging Network, It has been an honor and a pleasure for me to share my insights with you today and a truly wonderful capstone of my career. Thank you.
Well, Ms. Grenfell, thank you, and thanks for those, you said 48 years?
Yes, sir.
So you started in second grade, and that's really good.
Thank you.
Dedicated your life to this work. Thanks so much for
You're
that.
welcome.
Ms. Painter, you may begin.
Thank you, Chairman Casey, Ranking Member Braun, and distinguished members of the Special Committee on Aging for inviting me here today, and Senator Blumenthal for that welcome. My name is Mairead Painter, and I'm honored to serve as the State Long-Term Care Ombudsman in Connecticut. As Long-Term Care Ombudsman, we serve as independent advocates for older adults and individuals who reside in residential care settings. The Long-Term Care Ombudsman program was established in the 1970s by President Nixon in response to widespread concerns over pervasive abuse, neglect, and mismanagement of nursing homes. Over the following years, the program was statutorily formalized as part of the Older Americans Act, or the OAA. My team in Connecticut, although small, is dedicated and strong. It's comprised of 12 staff members, including myself, and we serve approximately 30,000 residents in about 400 long-term care facilities. The Ombudsman's activities are performed on behalf of and at the direction of residents and is strictly confidential. We provide direction for services, information about residents' rights, including consultation, investigation, and complaint resolution. Our non-mandated reporter status reassures residents that their communication with us is confidential. This is encouraging to them because they can speak to us and get our guidance without fear of reprisal. Our office frequently receives complaints concerning general care issues. These complaints can be adversely affecting to them about their basic care needs. For example, in some cases, residents are informed that they must choose what days they can get out of bed because they lack available staff to assist them. Other complaints might pertain to involuntary discharges, where residents receive notices that they're being discharged from the facility or instructed that they might have to leave immediately and that they're being sent to a homeless shelter or a hotel. In these cases, our team works closely with the residents to try to ensure that their rights are upheld and that proper procedures are followed. Despite an increase in care settings over the years, Ombudsman programs have not seen the corresponding increase in funding. Many programs receive minimal state fundings, and some programs, like in Tennessee, only receive enough funding to pay for the state ombudsman's salary. This lack of investment in the state funding, coupled with stagnant funding at a federal level, hampers our ability to meet increased demand. Half of the states do not have adequate staff to meet the 1995 Institute of Medicine staffing ratio, which recommends one ombudsman for every 2,000 long-term care beds. This report, while outdated, provides the most reliable staffing standard for the program to date. Connecticut's program currently operates with one regional ombudsman to almost every 3,800 long-term care beds. Additionally, the increased number of residents with complex care needs who depend on our advocacy underscores the necessity for Ombudsman to be able to be responsive. The original program relied heavily on volunteers, but today demands often exceed what volunteers feel equipped to handle. We need to reevaluate our reliance on volunteers while adding more trained and paid ombudsmen across the nation. Most critical is funding limitations impede our ability to educate individuals, respond promptly to complaints, and monitor facilities before crisis happens. This critical funding would also result in cost savings to the greater healthcare system. Although ombudsmen may work as state employees, our roles require independence. In addition to monitoring and responding to complaints, our program engages in education and outreach, both at a facility level and in the broader community. We also undertake rigorous systemic and legislative advocacy. Once I got to know other state ombudsmen, I began to realize that in Connecticut, while federally mandated under the Older Americans Act to have autonomy, it is not upheld in all the other states. Many of my peers cannot speak out about the interference that they experience, as it might jeopardize their jobs. This is unsettling because ombudsman must have the autonomy to advocate in a bipartisan way in order to advocate on behalf of the people that we serve. This leads me to one of the reasons that it's essential that the National Director position for Long-Term Care Ombudsman be refilled. It is necessary to have that independent voice advocating for our role. As a representative of the state ombudsman across the country, I strongly urge you to reinstate the National Director for the Ombudsman program. I want to thank you for allowing me to offer you this testimony today, as many individuals are still unaware of our role, their rights, and the standards of care that they should expect when receiving long-term services and supports. As Ombudsman, our goal is to continue to protect the health, safety, welfare, and rights of all individuals receiving long-term services and supports. Thank you.
Ms. Painter, thanks very much for your testimony and for your good work. We'll turn next to questions, and I often say at this point in the hearing how challenging Thursdays can be around here with a lot of conflicting hearings. That challenge applies to me today, so I'm going to have to step out to get to a hearing and then come back. But the committee will be in the capable hands of the ranking member, and I think we'll start with, in my place for questions, we'll start with Senator Blumenthal, and then we'll turn to Ranking Member Braun. Thank you.
Thank you, Mr. Chairman, and I appreciate your yielding to me. And I want to thank all the witnesses for your excellent, insightful testimony. Ms. Painter, I am particularly interested in your comments about the need for autonomy and independence and also adequate funding. Connecticut may be doing better than other states, but still, your point about needing additional resources, I think, is extremely important. And perhaps you can tell us how those resources would be used in Connecticut and by other similar ombudsmen or offices around the country.
Yes, thank you. So the staffing that we need is trained, paid staff in order to meet the demand when the calls come in. We don't want to have to triage calls. We want to be able to answer the calls when individuals say that there's a need. We want to be able to go out and meet with them directly. It's important that they have the confidentiality and the ability to meet with us face-to-face. When you're talking about having to choose or only being able to represent some of the residents, my team right now is almost double the amount of individuals that they serve. We try to get out to everybody within 2 to 3 days, but sometimes that's taking up to a week. And like I said, we have one of the better staffing ratios in the country. For some, I think it was Senator Braun brought up, it was almost 10,000. So we're almost 4,000, some are 10,000. So that's the major difference there.
I understand your point about the need for independence so you can speak out.
Yes.
But at the same time, it's important, isn't it, that ombudsman offices be supported by the administration in Connecticut and around the country? Do you find that support less robust than it should be?
I have the support at a state level where so different ombudsman's offices are set up differently. They're either housed within a state agency, which is centralized, or decentralized, which is outside of a state agency. So I am within a state agency. However, I am independent, so I have autonomy. They support me in the ways of a fiscal office and HR. However, I can advocate on behalf of the residents in the way that the residents or family members direct me to do so. It is challenging for my peers because when something, for instance, staffing levels or other issues come up at a federal level, for them to be able to testify either at a state or federal level, they don't always have the ability, or there may be a manager if they're decentralized or someone that tells them they're either not able to speak out against that or to speak to a reporter. I am able to independently speak to reporters, the media, anyone who contacts me, and I do not have interference at a state or federal level.
Do you have authority to go to court, to take action in court?
If I see necessary, yes, I do.
And do you do that commonly, or is it a rare instance?
It's a rare instance.
Would you do more of it if you had more resources?
Potentially. If there was a need and I felt I needed to, yes.
And that would provide a stronger deterrent as well as remedies for the individuals who may be suffering unfairly or painfully in facilities that aren't doing their job right.
Potentially, if we had the ability to work on the cases and to have the staff out there to work the cases in those ways, we may have the ability to get the information necessary to move cases forward.
You mentioned a couple of instances that you found where perhaps residents or patients were not treated well, being unable to get out of bed when they wanted to do so, involuntary discharge. Are those the two most common kinds of complaints? What are the most common kinds of complaints that you receive?
I believe the two highest complaints that we heard this past year were related to individuals' care plans being honored, right? So them having a say in their individual plans of care and those being honored. And that was directly linked back to staffing. When we really looked at why their care plans weren't being honored, it was because they didn't have the staff to be able to do that. It wasn't that the staff didn't want to. They weren't able to complete those things that the residents wanted done because the staff weren't there to do that. And the other highest area is involuntary discharge.
Thank you. My time has expired. This area is of great interest to me and very important. State of Connecticut. Again, I appreciate your very significant work and the need for more resources. Thank you.
Thank you.
Thank you, Senator Blumenthal. We'll go next to Senator Ricketts.
Great, thank you, Ranking Member. As the nation's population ages, counties face increasing demand and challenges in providing comprehensive systems for the care of older Americans. The Older Americans Act funds programs and services that enable older adults to enjoy healthy, productive, and independent lives in their homes and communities. Services authorized by the OAA include, but are not limited to, family caregiver support, health and wellness promotion, job training, nutrition programs, transportation, and programs to prevent and address elder abuse, neglect, and exploitation. The OAA provides states not only to target services to people with the greatest social or economic need, but also to make programs available to all older people in the community. The Older Americans Act has been the primary federal legislative source supporting social and nutrition services to Americans aged 60 and older since 1965. OAA programs are vital for seniors who are at significant risk of hunger, isolation, and losing their ability to live independently. We have heard about the Meals on Wheels and the great work that they do providing home-delivered nutrition services to older Americans, and the Older Americans Act helps fund this critically important program. When considering care for older Americans, loneliness is often overlooked. Studies undertaken during the COVID-19 pandemic demonstrate a significant increase in reported loneliness among older adults. A study conducted at the University of Nebraska, Omaha, found that 39% of older Nebraskans reported feelings of loneliness and 35% reported feeling lonelier due to the impacts of the pandemic. And that was my experience as governor of Nebraska. One of my concerns was in our skilled nursing facilities and assisted living facilities due to the restrictions that were placed on those facilities. Concerned about the folks in those facilities being isolated and the loneliness that goes along with that, not being able to get access to their families and that sort of thing. As a result, last November, I introduced the Improving Measures for Loneliness and Isolation Act with my first district congressman, Mike Flood. This would direct the Secretary of Health and Human Services to establish a working group to formulate recommendations for standardizing the measurements for loneliness and isolation. Ms. Hochler, you mentioned that in part of your remarks that lack of broadband actually limited social interactions. In general, what are your thoughts with regard to loneliness and finding a way to come up with uniform measurements for loneliness? Would this be something potentially beneficial? I mean, everybody I think mentioned about the wellness checks that the Meals on Wheels do. Tell me a little bit, what are kind of your thoughts on this?
So during COVID, obviously we did the wellness checks, as you mentioned. Some of the other activities that we engaged in during COVID included porch drop of activities. We created a manual, so to speak, that had activities and games and trivia, and we were able to porch drop those to individuals that we were concerned about, that we knew were at high risk of social isolation and loneliness. We continued that for a while with the COVID relief funding, but since that money is gone, we're struggling to be able to continue that. And we have done some other things to get folks out of their houses since COVID kind of opened back up. We are providing coffee and canvas programs, they're art programs, and we provide those in senior centers, and they're a more relaxed activity than an evidence-based program because you can come, you can participate in the activity, and it's just a lot more relaxed than a classroom type activity. So we have done some of that. Again, funding is an issue, and we would like to be able to continue that. One of the other things that we think is very important is we would like to see the National Resource Center for Engaging Older Adults codified in the Act. This is a valuable resource for AAAs. It provides training and technical assistance on social engagement.
So would you think it would be helpful, because you mentioned the evidence-based programs, the flexibility to use that, would it be helpful then to have some way to measure loneliness, to be able to, for example, be able to determine who's most at risk, establish baselines, who would be the, the folks that you would need to focus on as the first priority for some of the programs you talked about?
I think that it would definitely be helpful, but I wouldn't want to add an additional mandate to what we're already doing. We've been doing this for 50 years, and we're able to recognize those individuals that we think are most at risk. That doesn't mean that we won't miss some, but I think while it would be helpful, I would not want an additional mandate, because when you add a mandate, it increases our costs.
So finding a way to be able to maybe establish the baseline, but do it in a way that's not going to impact or mandate you do extra stuff without actually providing the funding to be able to do it.
Right.
Right.
Yes.
Right. We tend to do that a lot in government. Okay, great. Hey, well, my time's up, but thank you very much, Ms. Hostler. I appreciate your insights on this.
Thank you.
Thank you, Senator Ricketts. Senator Gillibrand.
Thank you, Mr. Chairman. State and local governments need resources and planning assistance to comprehensively address the needs of our aging loved ones. I'm proud to lead the Strategic Plan for Aging Act with Chair Casey, which establish a grant program for states, territories, and tribes to create or continue developing a multi-sector plan to transform the infrastructure and coordination of services for their aging population. Ms. Grenfell, thank you for your testimony and your 48 years of work in the Aging Network. Could you please describe the ways in which legislation like the Strategic Plan on Aging might help a state like Pennsylvania with continuing to develop its 10-year multi-sector plan for aging?
Yes. Thank you, Senator. That's an excellent question. Regarding Pennsylvania's work, there was considerable effort to ensure that we received input from a multiple number of stakeholders. There was effort made also to have a vast majority of older people, as I mentioned. I think that that legislation that you're referring to would be extremely helpful, not only to the work that we're continuing to do into Pennsylvania, but to incentivize other states to possibly move into a direction of a multi-sector plan. I think it would be extremely helpful. I think what we're hearing today is that states and local area agencies on aging are struggling. And if there would be a way to incentivize such planning on a national level, we already know that other states have implemented such plans, and Pennsylvania is in the implementation stage. I think would go a long way to ensuring that older adults across the nation receive that same type of respect in terms of the planning process. So I thank you for that question.
What, Ms. Grenfell, do you think is most understood, misunderstood, or overlooked as part of the Older Americans Act, and what does Congress need to know about it?
Well, I think what's most misunderstood is the provision about the state units on aging having oversight over contracting that local area agencies on aging are involved in to help ensure that the constituents that live in their geographic area are able to receive a number of services. There seems to be some confusion on whether or not the state units are to have oversight over all types of contracting or just the contracting that would leverage potentially Older Americans Act funds,
right,
as opposed to non-Older Americans Act funds. So in Pennsylvania, we're very involved in in the level of care determinations. And so that contract for us, the Southwest Area Agency on Aging, allows us to bring in over $1 million. That funding then helps to reduce other funding that we might need, but allows us to use more services and programs, provide more services and programs, if you will, to the population that we serve.
Great. Since 1972, the Older Americans Act nutrition program has been successfully meeting its purpose to reduce hunger, promote socialization, and support health amongst older adults. During fiscal year 25 appropriations process, I'm proud to have called for $1.8 billion in funding for this vital program to fund congregate and home-delivered food services for older adults. Ms. Billette, thank you for sharing your story. It is vital that older Americans can age in place. Could you please explain the ways in which home delivery food services impact your ability to live in the setting of your choice?
It is helpful for me to receive services at home because that way I don't have to go to the nearest grocery store, which would be 8 miles to Phillipsburg, 10 miles to Clearfield for my doctor's appointments. It helps me to be in my home and be secure that I can have Fred, my delivery man, deliver Meals on Wheels to me, and also that I can receive someone to take me to my doctor's appointments. And for the nutrition part, I believe that through the Senior Farmers Nutrition Act, that also is very helpful for my cancer.
What would happen to you if you were unable to receive home-delivered meals?
I would have to go to someone and hire them to take me to the grocery store and then to learn how to cook all over again.
Yeah, it's a lot. Well, I just want to thank all of our panelists for their dedication and their strong support for our older Americans. Thank you for all the hard work you've done, and thank you for your testimony.
Thank you, Senator Gillibrand. We'll turn next to Ranking Member Braun.
Thank you, Mr. Chairman. I want to start with Ms. Holscher. In the OAA final rule, the administration expanded the definition of greatest social need. These criteria are used to determine which seniors should get priority for meals. With waiting lists and challenges in food delivery, is it justified to expand the definition of greatest social need?
I think the definition needs to remain broad and allow the local AAA to determine who is in the greatest need through their local area plans and their needs assessment. My area doesn't look like Juneau, Alaska, or Indianapolis, Indiana, for that matter, and we need the flexibility to plan for and meet the needs of the older adults at the local level.
We've heard about how partnering with other aging service providers can magnify your reach while making each dollar go further. I applaud this local entrepreneurship. Our national debt, as I said earlier in my opening statement, is ballooning to the tune of $1 trillion every 6 months. To put that in perspective, that was just, well, it's a lot of zeros after a one. It was $1 trillion annually just 5.5 years ago. We're now $35 trillion in debt, and 5.5 years ago, 18, which was approaching a record. What steps should we take to support entrepreneurship in the aging network, and do you think this will bring costs down and yet still be more effective?
We would ask that the flexibility and control of business arrangements, such as contracting with healthcare entities to deliver home and community-based services under Medicaid, be restored to the local AAA level. We have been charged with building comprehensive systems of services by leveraging local and private funding, and we need to be nimble to do that without delay. We have a long history of preventing conflict of interest and managing multiple funding sources, and it's important that we maintain our independent status without the restrictions or barriers.
One more question for you. In your testimony, you called for more flexibility in the Older American Act's health and wellness programs. Currently, and by the way, health and wellness and prevention and all that is what I wove into my health care plan back many years ago in my company. And pretty well, when you do that right, you can halt your healthcare costs and insurance costs, so it can be done. And I know that it hurts in places where you got communities that are already strapped for resources. Can you explain how allowing evidence-informed programs would expand the reach and effectiveness of services?
The flexibility in Title IIID to incorporate evidence-based programs would allow the network to reach older adults with emerging innovations and enhance our ability to stretch the limit of Title III dollars and reach more people. In my area, we would like the opportunity to try a program called Building Better Caregivers. It's a 6-week online workshop for caregivers of veterans, and this flexibility would allow us to do that. Right now, that is not a program we would be able to offer because we do not have the funding.
Thank you. Ms. Painter, the long-term care ombudsman program exists to identify, investigate, and resolve complaints made at long-term care facilities. State ombudsmen submit reports to the administration on the cases they handled each year. However, it is unclear how this information is being utilized. How would summarizing this data and making it public improve transparency at long-term care facilities?
We agree that this information should be available to the public and to policymakers. We think that it's important that transparency is available to everyone. There are millions, billions of dollars going out to long-term care facilities, and that in many cases, individuals are spending down their private dollars and going on Medicaid. And if it is federal dollars that are being spent in these facilities, that there should be good policies for oversight and transparency about how those dollars are being spent. And if it's our programs that are looking at those cases and doing those investigations, and by you all having access to that information and what we're seeing would give you better ability to make policies, then that should be available.
You know, an ombudsman service is a portal of feedback, and I think any business, any entity ought to welcome it. In your experience, do you get a lot of it, and do you learn a lot from it?
Yes, we do have a lot of information. We would, of course, want to make sure that it remains confidential, people's names, information in that way, so that they continue to feel confident in giving us that information. But the actual data related to cases of mistreatment, abuse, neglect, the amount of times that people go to the hospital, involuntary transfers and discharges, because I do believe that that directly impacts cost savings, and when individuals are not given information about informed choice to return to a less restrictive setting, or are encouraged to stay in the nursing home versus go to a less restrictive setting, I think that is very costly to our long-term care system.
Makes sense. Thank you. I yield back.
Thank you, Ranking Member Braun. I'll do my questions now that I'm back. I wanted to start with Ms. Billett. Janet, I'm noting in your testimony, you shared how not only that you've enjoyed receiving a meal, but you also have enjoyed seeing your meal delivery driver, Fred, and you've become friends. And that's just such an important part of the services that, as you made reference to. A critical piece of the home-delivered meals, the program itself, and OAA programs in general, not only you're receiving important services, but you're able to make friends and build relationships. In fact, towards the end of the first page of your testimony, you say, quote, "The Area Agency on Aging is my family," unquote, which I think speaks volumes of what we're talking about. In this brochure that I made reference to earlier about these Pennsylvanians, one of them is from Erie, Pennsylvania, Doris Fillauer, and she talks about her experience, and I'm quoting her here from the brochure. She says, quote, "It has filled my life with new friends over the years. It's my home away from home." And I think that says it all. So this is obviously an important part of the benefit that you derive from these services. Can you share more about the social connections you've been able to build through the Clearfield County AAA?
With the AAA services, I've been able to receive doctor's appointments, and we become friends with many people that deliver the Meals on Wheels, and also that we can depend on those people checking in on us each day so that we have someone to support us and that we'll know how we are and what we're doing that day. So I think it's very important to do that.
Yeah, and it's obviously part of life that we
Yes.
have relationships and we're able to see people. And I think one of the more remarkable pieces of evidence the last number of years, especially during COVID, was sometimes when someone was receiving a meal, that person delivering the meal was the only person they saw for
Right.
days at a time, if not to include as well the postal service worker. But I think we all understand what you're talking about. Ms. Grenfell, I wanted to make reference to your testimony as well, that Pennsylvania is currently working to develop and implement a so-called multi-sector plan for aging. These plans help states and localities come together to collaborate on ways to make communities work for older adults. The response throughout our Commonwealth from community stakeholders is really impressive. You've lived this, and I want you to know how important it is for us to try to pass the Strategic Plan for Aging Act, Senator Gillibrand and I and others, to incentivize states to start their own planning processes. Can you, or I should say, how can we ensure that state governments are hearing the voices of older adults and non-traditional aging partners across the state?
Thank you, Senator. The process that Pennsylvania undertook involved multi-sector planning, as I mentioned. And so what we attempted to do was to receive the non-traditional type of input from departments, state departments, as well as local area planning areas, as well as the elected officials that were local, the American Legions, all the infrastructures that were available locally. So that plan that we're developing will entail the opportunity to have diverse input and will allow Pennsylvanians to have the breadth of a larger plan that takes all of their considerations and their input into practice. So we're really excited about moving forward on this plan. It's very transparent. That's the other important part of the plan. And as I said, we're looking forward to its implementation stage, which is coming up. In terms of having any incentives to do that, if that's an opportunity for other states, I think it would be well received. Pennsylvania could certainly use additional funding if it was available. And thank you for presenting that opportunity as a legislation attempt. We appreciate it.
Well, I think funding is a big part of this equation. We appreciate making reference to that. I'll turn next to Senator Kelly.
Thank you, Mr. Chairman, and thank you for having this hearing today. Since I've been in the Senate 3.5 years now, I've been very grateful for my seniors advisory group that I meet with often to discuss issues impacting Arizona seniors. And most of the group is made up by representatives of the Arizona area's agencies on aging. And because of that, I've gotten to understand the essential role that the area agencies on aging play in their communities, from providing meals to helping somebody find a direct care aid to connecting older adults to benefit programs to make the most out of a fixed income. These organizations are, in many areas of my state, the backbone of the aging services community, and they call themselves the best kept secret in Arizona until folks turn 60. So I want to make sure we all understand why it's so important that we successfully reauthorize and fund programming in the Older Americans Act. So Ms. Painter, your role is authorized under the OAA, but you're also deeply immersed in the rest of the aging network. Could you speak to how the OAA and area agencies on aging fit into the aging ecosystem and why they are so important, not only to Arizonans, but to all Americans?
Thank you. That's a great question. I think working in partnership in order to support individuals at the lowest level of need so that they're able to age in a healthy way and to support them before they have the highest level of need. That way, we are giving them, I think we spoke about good nutrition, access to programming, information about health and wellness, and we want to encourage individuals to be a part of their communities.
And would those be examples of the lowest level of
Those are
need?
the lowest level of need. And doing that on an individual level, so the area agencies on aging, I can speak for Connecticut that I know, they meet with their communities and they talk to the individuals that they serve about the programs that they want in their areas. And so it's really about ensuring that they're meeting the needs of the individuals that they serve, because it could be different district to district. And so we want to make sure that if it is an ombudsman program that is decentralized, they may also house some ombudsman within the area agency on aging. So they could be having information about what services are needed from the ombudsman's office. They could be speaking about what they're seeing related to long-term care, home and community-based services, as well as meal delivery services or even transportation services. We know that comes up a lot for individuals and how they're reaching doctor's appointments or access to food and other resources. So I think if we're not able to do that, we would see people needing higher levels of care, which is more expensive, more quickly.
All right, it's true, I think, in a lot of areas of healthcare as well, as trying to tackle the problem earlier can be less costly. Ms. Billett, thank you for being here today, and thank you for sharing your story, and I'm sorry for your loss. Your testimony about your local area agency on aging, about how they made sure you were fed and looked after during your illness was very powerful. You mentioned your interaction with Fred, who delivers your meals. As we work to reauthorize the OAA, Arizona's area agencies on aging have requested that we allow them one unified nutrition program so they can determine how best to split the congregate meals and home-delivered meals to folks who qualify. And the Arizona agencies have said that would make it easier to fill the needs of their local communities. Nearly all of them have a wait list for home-delivered meals, but they aren't seeing the same demand for in-person congregate meals. I think some folks up here are a bit hesitant to create one single nutrition program because socialization is such an important part of the meal program within the OAA. So, Ms. Billett, do you feel like your home-delivered meals were the right fit for you when you needed them, both for your physical and mental health?
They were. It was very helpful when my husband was sick and I also was sick that we received these meals and were able to understand that they were nutritional and that they did help us, that we were able to receive them. I also understand that there were many more Americans that are on this waiting list for the Meals on Wheels, and would appreciate that you would speak to people that would be able to put this program into service so that we could receive services. And I think that it's very helpful to us as American citizens.
All right. Well, thank you, Ms. Billett, and thank you, Mr. Chairman.
Thank you, Senator Kelly. We'll turn next to Senator Fetterman. Oh, I'm sorry. I'm sorry. I didn't realize. Senator Vance.
Thank you, Mr. Chairman. I appreciate Senator Fetterman for pushing back against your Pennsylvania bias there. But thanks to both of you, and thanks to you and the ranking member for hosting this hearing, and thanks to all of you for being here and giving us some sense of what you're working on and how we can make things a little bit easier for people. So I come at this with some personal experience with Meals on Wheels program. My grandmother, who I lived with for a very long time, benefited from the program. And it was a very, I think, critical part of keeping her healthy and happy during a pretty tough time for our family. I want to sort of direct my questions to Mrs. Holscher. Is that pronouncing that right? Okay, great. And I'm sort of interested in the two sort of meal programs, the Older Americans Act, and how they sort of can provide flexibility or take some away if we don't do this the right way. So maybe just, Ms. Holscher, given your extensive work in Indiana, what factors inform seniors when they are choosing between congregate meals, going to a place for a meal, versus things like Meals on Wheels?
Well, some of it has to do with transportation.
Sure.
And if they have access to a senior center. In some of our very rural areas, there aren't senior centers. So there is no choice. They would have to access home-delivered meals. Some of it has to do with some of our senior centers have been around for 50 years, and they're in older buildings, in basements, and they're outdated. And the seniors today want choices. They want places that they can go that will engage them in activities. We have one senior center that's in the basement, and I personally feel like it's haunted. And I have heard that from other older adults. And so they want choices, not just here's the senior center. They want places that they can go where they can engage in today's activities, such as like our Coffee and Canvas project that we do. And sometimes it's about just because you're isolated doesn't mean you're lonely. And some older adults prefer to eat at home alone, but we still try to find ways to engage them in other activities. So I hope that answered your question. Thank you.
It does, and I guess, one thing is, if I understand it correctly, and please correct me if I'm wrong, is that you saw, understandably, during COVID, especially in that sort of summer of 2020 time period, a really massive increase in demand for things like Meals on Wheels. We're now close to, well, almost exactly 4 years after that. Where do you think we stand? Has demand fallen? Has it stayed the same? Where, are we seeing seniors less interested or more interested in that service?
In our area, we've seen a 20% increase
Wow.
in requests for services, older nutrition services. So while I think it's stabilized a little bit after COVID, the increase is definitely there in the last 2 years. A 20% increase that probably has more to do with they can't afford their basic necessities, and so they're reaching out to us for help with nutrition to offset some of those other costs.
Got it. And could you just explain to me sort of when the money's coming to an agency like yours that I believe you've worked with for close to 30 years, right? And does it come in as, are there separate buckets?
Yes.
There's money for congregate, there's money for Meals on Wheels, and you don't have, am I correct, you don't have flexibility in moving them between the two programs depending on the demand for seniors in your area?
We do not. We
Okay.
had that flexibility during COVID, and it was very helpful, obviously because most of our congregate sites were closed during
Sure.
COVID. But since the public health emergency has ended, we no longer have that flexibility.
I see. And so I guess I'm probably asking the obvious here, but am I right that you'd prefer to have more flexibility in how you actually provide these services?
We would definitely prefer to have more flexibility at the local level. We want to meet the needs in our area, and we can only do that with flexibility between funding sources.
Yeah, and I can imagine too, just that between rural and urban areas, you could have a small town that might have one set of preferences. You could have a bigger city that might have a different set of preferences. Obviously, maybe a little easier to get to a senior center if you're in Indianapolis or Columbus or Cincinnati. But appreciate your testimony here, and certainly share your view that flexibility would be a good thing here, and maybe we can work on that. Thanks.
Thank you.
Thank you, Senator Vance, and sorry about the mess up in the order. I will now turn to my colleague from Pennsylvania, Senator Fetterman, with that long buildup.
Thank you, Mr. Chairman. Ms. Grenfell, can you speak to the barriers that exist to the LGBTQ plus older adults and aging individuals with HIV in accessing programming established through the OAA?
Thank you for that question, Senator. As we know, the LGBTQ plus community has faced many barriers over the years, discrimination, difficulty accessing health care. The Older Americans Act programs are based on need, and so our job is to ensure that we are creating an inclusive environment that's welcoming to all communities. Our agency is certified Platinum SAGE informed, and so our staff has made sure that we are all in the position to be able to understand exactly what their history has been, how we can ensure that we have welcoming senior centers, how we can ensure that we have services and programs that meet their particular needs and are sensitive and inclusive of their needs.
And you're able to confirm that the special kinds of needs and other issues to those kinds of communities are being fully addressed?
Well, Senator, we are, to the extent that we're able to include and that are welcoming and have.
So that language seems specific. What are you referencing then?
Well, I'm specifically referencing the training that our staff has undergone, and that there are particular questions that are in part of the assessment process that are identifying if the individual is willing to self-identify. That's not necessarily everybody is willing to do that, but those that will, then we're able to.
So in other words, somebody might be, they might not be not comfortable to identify in that member of that community. They would be actually missing those kind of critical services then, right?
They could, yes. Yes, they could. Yes, they could. However, I think that in general, it's important that there be adequate training for staff and that area agencies on aging are well informed of the need to be inclusive, have environments, have policies in place which allow for all types of individuals to receive the services at that level.
Okay.
Thank you, Senator.
Okay, and now currently the OAA is set up to serve Americans 60 and older. Other federal programs don't kick in until 65. There are a lot of Pennsylvanians between 60 and 65 who rely on these critical programs. OAA bridges this gap. Ms. Painter, can you speak about the importance of offering these programs before the eligibility kicks in on all the other federal programs?
Thank you. Yes, I believe, again, the earlier we can intervene and support individuals and offer them the ability to stay healthy, have access to supports, the better we'll be able to maintain their health and well-being and enhance their wellness in order to prevent them from needing higher levels of care at earlier ages and stages of their life.
Okay. And finally, ensuring Pennsylvanians can have food on the table. I mean, that's a top priority personally for me, but of course for the Commonwealth as well. And about 5% of older Pennsylvanians are food insecure. Recipients of OAA provided meals report that this is half or more of the food for that day. Ms. Bolette, is that correct? Yeah. How important are these kinds of home-delivered meals for overall and for your nutritional meals?
I believe that our area agency of Clearfield County has obtained a chef that will help each individual meal be characterized like what the need is. We all have a menu we go through each day, and they provide meals to us. The nutrition meal for me was for my cancer, was very helpful. To help me get through cancer.
Mr. Chairman, about 30 more seconds. Is it also good also, it's also another point of contact for some seniors that may not have any other kinds of contact, like essentially well checked on there, like making sure everything's still okay.
That's very correct, because my meal delivery man, Fred, is my only contact during the day, many times to talk to and to see each day. So that's very helpful that he checks in on to me to see how things are.
Yeah, and also my own grandmother, she fell and she didn't have a situation like this, and she wasn't able to get contact for several days. So the horror of all of that. So not only cursing the critical food, but just also kind of that interaction, but also like it's a well check, just how critical it is to make sure that everyone is going to still be okay.
That's correct. And with my transportation issue, it was for my cancer to go to the chemotherapy and to my doctor. It was very critical because there is no Ubers, no taxis, and no transportation in my area because we live in a rural county. So that's very helpful if I can have transportation to and fro from my doctors.
That seems almost beyond helpful. I mean, that's critical to maintain your health and your way of life. So,
at that time, I didn't drive while I had cancer for the year. So, not driving for a year is critical in finding someone to help.
Thank you for all of you. Thank you, Mr. Chairman.
Thank you.
Thank you, Senator Fetterman. I just have maybe two more questions, and then we'll have to wrap up. I wanted to ask a question of Ms. Painter. In your testimony, you spoke about the long-term care ombudsman program desperately needs more federal funding to account for the sheer number of older adults who are now residing in long-term care settings, especially assisted living facilities. Many of these residents may worry about retaliation if they raise issues themselves. Others may not have the ability to self-advocate. That's why the long-term care ombudsman program is so important, and you're a voice for older adults who may be both uncomfortable or unable to advocate for themselves. However, you can't do this essential job without the funding. I released a report last year entitled Uninspected and Neglected. That the report revealed that lack of investment in ombudsman and nursing home surveyors leaves nursing home residents at risk. Today, at my request, the GAO is releasing new findings on the increased complexity of cases and the impact that limited budgets have on ombudsmen. In fact, Connecticut is one of 5 states highlighted by GAO. Based on this data, I'm advocating to triple the amount of funding for long-term care ombudsman programs in the Older Americans Act reauthorization. So here's the question. If it's clear that additional funding would help ombudsmen stay afloat, can you describe how additional funding would directly impact and improve the lives of older adults living in long-term care facilities?
Yes, well, thank you, and for advocating for us to have that increased stable funding. We so appreciated the funding that we received during COVID, and we realized how much we could do, even though we weren't able to access the buildings initially. Once we had that funding and we were able to do more outreach, that we were seeing an increase in cases, and we've seen a steady increase in cases, and I think with additional funding that would continue, because when we were able to meet that mandate of being in long-term care facilities on a regular basis, it's not necessarily that individuals know to reach out to us. As I said in my testimony, individuals don't know what their rights are, always related to quality of care. And so when you have the access to a regular ombudsman who is in the building on at least a quarterly basis, going around, introducing themselves to people, explaining their rights and ensuring that they know what quality of care looks like, talking with them, explaining to them the grievance process, explaining to them that they have the right to transfer to a less restrictive environment, to attend a care plan meeting with them and talk to them about what their plan of care can look like and what they should be expecting, that they don't have to just decide to get out of bed every other day, right? The expectation should be that they get out of bed when they want to get out of bed. They should be able to get to the bathroom or have nutritional support when needed. I think that's when we'll see those changes, and I think that that will impact cost savings as well, because we won't have those visits to the hospital where people have wounds or infections and those types of things, because the interventions that Ombudsman are able to provide one-to-one with the nursing homes when residents allow us to. And sometimes it means multiple visits. When you have that rapport with a resident, sometimes initially they don't want us to do anything. We just have to go back a few times and reassure them that we can have that conversation with the long-term care community. And when we talk with them, they put those interventions in place, and then the resident sees that benefit. And I think that's where we'll see the biggest change in care.
Ms. Painter, thanks for that response. The last question I have is really for the panel, but I might ask Ms. Grenfell and Ms. Holscher to address it first. But if anyone else wants to add to the conversation, as I mentioned earlier, we've got a bipartisan group of Senate colleagues that are leading the effort to reauthorize the Older Americans Act. We're not only working to reauthorize the act, we're also working to modernize it, to make sure that we're meeting the needs of today's older adults and the needs of future generations of older adults. The reauthorization provides us with an opportunity to look at what has changed in the last 4 years since the 2020 reauthorization, what innovations were critical throughout the COVID-19 pandemic, and what needs are still not being met. How have you seen the needs of older adults evolve over your careers, and where is modernization needed most within the Older Adults Act? Maybe Ms. Holscher, and then we can go from there.
So the needs have changed, I guess, over the years. Is today's older adults want choices. They want to be able to choose from a list of meals. They don't want, here's a cookie cutter meal, everybody gets it.
Right.
And that is true in all 6 counties that we serve. So what the folks in Pike County might want is different than the folks in Du Bois County. And they want those choices, and we need the flexibility to be able to provide those choices to them. As well as we need the flexibility to come up with new ideas. We need to be able to pilot programs, and the funding right now doesn't really allow for us to get out of our box, so to speak. And so we would really like to see more flexibility so that we can implement new ideas, emerging innovations, and be more entrepreneurial.
That's great, thank you. I might reframe the question a little bit for Ms. Grenfell because of her impending retirement. So I guess the question for you would be, what's your hope for the Older Americans Act moving forward?
Well, I certainly agree with my colleague Laura from Indiana, because those are critical issues for the Older Americans Act. I would also say that our National USA Aging organization has really spent a lot of time and effort with the Older Americans Act and has excellent recommendations for moving forward, and I think for modernizing it. It's not always just about money either. I mean, money is important, and we've all mentioned that. But it's also, as Laura mentioned, it's really important that we're able to do some innovation. Southwestern Pennsylvania has certain meals that they love, and they don't necessarily meet the nutritional requirements exactly. I think we have to update a lot of that in terms of the whole nutrition program to make it more available. The COVID-19 grab-and-go meals have been extremely successful. Mm-hmm. We're finding that our population likes the fact that they're available and they're flexible and they can come to a center when they have time, or if they're caring for somebody at home, then they can pick up a meal for their loved one and them and get a little bit of respite. So we're also looking at trying to do some innovation with maybe, because of the ruralness of our service area, of a cafe, a pop-up cafe, where we'd be able to take the meals in more rural parts of our service area and have them available, as opposed to an infrastructure like a senior center that's a lot more costly. So we're looking for innovation and cost-effective, cost-efficient ways to provide the program. That type of innovation is what I think both Laura and I are looking for, and that would be something I would hope for. So thank you, Senator.
We're grateful for that, and I think that innovation is going to be important, and obviously giving seniors choices is also important. Who wants to be locked into one choice for a meal? That should be part of the opportunities we provide. I'll move to our closing statement. I'll have a closing statement, then I'll turn to Ranking Member Braun, and then we'll have to wrap up. But as we heard today from our witnesses, the Older Americans Act is a landmark piece of legislation that's been providing life-saving services to older adults for nearly 60 years. To put it simply, these programs authorized through the Older Americans Act are working well. The area agencies on aging, senior centers, Meals on Wheels programs, and others provide services tailored to the unique needs of their communities. The individuals who make up the Aging Network are dedicated to this work, and with many having devoted their entire careers to improving the quality of life for many older adults. Ms. Grenfell, I'm making reference to you here. They are the trusted partners in our communities. I think everyone on both sides of the aisle can recognize the importance of the Older Americans Act in preventing chronic diseases, in reducing social isolation and loneliness, and enabling older adults to remain at their home in their communities where they would like to be. However, we cannot expect the Aging Network to continue to work for older Americans and their communities if we're not willing to provide the programs with adequate funding. As we heard today, due to funding limitations, there are thousands of older adults waiting for services across the country. From meal services to Ombudsman assistance, wait lists and wait times will only grow if Congress fails to act. Folks like Janet should not be forced to wait for needed meals and services, and that's why through the reauthorization, I'll be pushing for increased funding for Older Americans Act programs, and I encourage my colleagues to join me. I'll also continue to advocate for changes to the statute that will better enable AAAs and local service providers to do their work. The Older Americans Act plays a critical role in the health and success of older adults in local communities from Pennsylvania to Connecticut to Indiana and everywhere in between. It is critically important the Senate invest the necessary resources to fulfill the intent of the Act. I'll now turn to Ranking Member Braun for his closing remarks.
Thank you, Mr. Chairman. We always have prepared remarks that we can default to. Since I've been here, I like to listen, hear what everybody says, and then sometimes just chuck the prepared remarks. This is a committee that I had to be recruited to get onto back when I came to the Senate, and it's one that we can't legislate out of, but for the time I've been here, we've had more pertinent discussions in this committee that other committees end up legislating off of. And in this place, it's always frustrating in that we've all heard, what we need. We've got future older Americans that have to pay all the bills and shoulder the debt. So we're kind of in that, between that rock and hard place. And it's not only here, it's across our government. Sure, we need more funding. Everybody needs more funding. But when you're borrowing 100% of it, remember, we're asking our kids and grandkids to pay for it. We got to get smarter than that. No other place does that work. And that's why being entrepreneurial, maybe turning more of the responsibility over to all the places that have to live within their means. And it was refreshing to hear from Ms. Grenfell that maybe it's not all about money. Generally, that's what this place is about. That's okay if you have it. If we're borrowing it from our future older Americans, our kids and grandkids, we have to step back and figure out how to be smarter and better, because then we're defeating the whole purpose of what this is about in this discussion. Thank you all for coming in. That's food for thought. Maybe we'll find a way to have our cake and eat it too, be smarter about it in the long run. Thank you.
Well, thanks everyone for being here today. We're grateful for the witnesses, for your testimony, and for bringing your own life experience as well as your professional experience to bear. If any senators have additional questions for the witnesses or statements to be added, the hearing record will be kept open until May the 30th. Thank you all for participating today. Have a great rest of your day.